I'm Erin Bernardi, and I'm a retired school counselor living on Lopez Island. I've been collaborating with the Lopez Island Family Resource Center as well as the folks at the Lopez Island Recovers Community Hub website, which hosts a variety of different agencies which are putting together resources for our community for COVID-19 support. Today I'm going to share a brief overview of a COVID CARE communication tool. COVID CARE, a model for moving forward, opening up social circles, is a 12-page PDF made available free to anyone by its creator, Dr. Erin Bernardi of Salem, Oregon. The PDF is made available in English and in Spanish, and interested organizations will also find a slideshow overview to support presentations of the communication tool. The URL will be posted at the last frame of this video. You can find this at lopezisland.recovers.org. I'd like to share a little of how I got involved with this project. I was online reading a digital magazine, Medium, and the more that I read, the more I was impressed with the author's approach, which was invitational and very win-win to our decision-making and the agreements that we can make with others during this time of an international pandemic. As a school counselor, one of my most beloved programs was training 4th and 5th grade peer mediators and watching them get to win-win with their peers, helping them solve problems, helping them express their needs and feelings, and getting to this win-win resolution. I feel that Dr. Dacker's approach in this COVID CARE communications model brings a lot of win-win opportunity to all of our community members. And at the very least, I think that we could use it as a communication tool, starting looking at some graphics and models and finding some common language and going from there in terms of the decision making that we need to make in our own households, in the workplace, out in the community, and with friends as our social circles begin to expand. What will be our new normal? Most of us are asking ourselves this question. As restrictions are being lifted, we will consider decreasing social distancing. At the same time, we must continue to work together to reduce risk of viral infection until accurate testing is available and we have reached herd immunity. This can be achieved through self-awareness and good communication. When I finished reading Erin Dacker's COVID CARE communications model, I wasn't surprised to learn that she had an extensive background in public health communications. A common thread in her work is finding a way that we can advocate for what we need to feel safe and discovering a way to communicate with friends, family members, community members in a way that they will best hear us and in a way that we can hear them, and that we can truly see and care about each other. Let's take a look at an overview of the COVID CARE model contents. COVID CARE calls in 4 specific elements to consider and discuss with others as you start broadening social circles. Number 1, your container or your pod. Number 2, agreements. Number 3, risk tolerance, and number 4, etiquette. Step 1 is identifying the members of your container, pod, or circle. Draw some overlapping geometric shapes. Add those that are currently in your container, household, or social circle. What are the risk factors? Are there any essential workers? You might want to create a secondary container including anyone you are regularly exposed to at less than 6 feet. Once you have identified the members of your container, you can explore what the people in your container need to feel safe and form agreements. What are their needs? Are there people with medical risks or circumstances they have no control over. There are guides for navigating various risk factors. If one person in the household socializes with others at less than 6 feet, other members of the container may wish to stay more than 6 feet from them. They may want to ask for extra cleaning of shared spaces, as well as wearing a mask when they're near each other. The highest risk person, or the person with the lowest risk tolerance, would ideally set the standards of an acceptable behavior in the container. What is your tolerance for risk yourself, and what are you putting onto others? This is a very controversial and difficult place to navigate as we reduce social distancing and open society back up. We each have our own personal tolerance for illness, death, disease. We're being asked to forsake joy, love, pleasure, and others for a period of time until herd immunity is reached. And it's very important that we take the time to take into account everybody else in our container and in our community at large. Risk tolerance does not supersede public health policies and governmental regulations. So why consider risk tolerance? Low or high risk tolerance does not make one better or worse. But with COVID-19, the need to be clear and conscious with one's choices is critical to the health of society. So the more someone is at risk of disease and death due to where they live, their health or pre-existing conditions, or their economic status, race, or age, the lower their risk tolerance. Others feel that they have less to lose if they get sick. They may be willing to take on more risks. One cannot know everyone's level of vulnerability that we come in contact with. Essential workers and those they care for have died due to others' inadvertent exposure. So if we look at a backpack as a metaphor, we can consider that the more you carry, personal risk factors, precautions, fears, etc., the slower you move, the lower your tolerance, the more likely you are to survive. The less you carry, risks, concerns, safety etiquette, the faster you move, or higher your tolerance, the less likely you will survive by putting yourself and others at high risk. When we think about protecting essential workers and the at-risk community, we realize that they may not have the ability to protect themselves with this conversation that we're having. So it's up to us, those of us who can, to help everyone stay healthy. In the next section, there is an extensive 0 through 5 risk tolerance scale. It takes quite a bit of time to go through it and review where you are on the scale or in between different numbers on the scale. The higher the risks, the heavier the backpack, the lower the tolerance. The scale is not inclusive of all situations, and it's a guide. It's not prescriptive. The intent here is to create a common vocabulary so we can communicate where each of us stand. The fourth section of the COVID care model is etiquette. Etiquette is an area that we're going to likely be most familiar with, as it's been a big part of our life recently. The measures and behavior we will use to reduce the risk of transmitting COVID-19 are masks, social distance, small groups, ventilated spaces, hand washing, and sanitizer, and anything else that we can do to mitigate risk. Until we have what we need to safely relax social restrictions, talking with others in our social circles can go a long way as we prepare to ride out this storm together. You can access a copy of the COVID care model outline at www.lopezisland.org. www.recovers.org.